So,
Hey, this is Dawson Fry. This is my CVAD video. My ID. You go ahead and scan the room. So first we're going to identify our patient, Jaguar J. Jones. Jaguar J. Jones, medical record number 417-6352, 417-6352. We see on the chart an allergy to penicillin and an armband allergy to penicillin. We would ask if there were any other known allergies, as well as verify the order, which we see right here, and we also would verify the hospital policy. We'd make sure that we explain the procedure to our patient, as well as provide privacy. And next, we perform hand hygiene, and we are going to assess through our tegaderm and palpate. And we are looking for any purulent drainage, swelling, pain, tenderness, anything that would show that there was a complication with it, and that would indicate cultures being needed. So next, what we are going to do is we are going to perform hand hygiene, and we are going to set our bedside table up. And so normally this would be above our waist, but it's not today. But we have our gloves, goggles, pen, and our dressing change tray, as well as tape. And so next, we are going to raise the bed and lower the side rails, and we will make sure that our patient's head is slightly elevated for this procedure. So next, what we're going to do is we are going to perform hand hygiene, and we are going to open our dressing change kit and remove it. And we are going to open the first flap to remove the mask, and we are going to put our mask on and our goggles. And we're also going to take this mask right here, and we are going to place this on our patient. So once we do that, we are going to perform hand hygiene and put our clean gloves on. And what we're going to do is we are going to remove our tegaderm. And with this, we are stabilizing our catheter by holding the inside portion, and we are removing the catheter, or the tegaderm, my bad, inward toward the insertion site. Once we remove this, we'll also remove the biopatch that was in there. We are going to assess for any, and observe for any swelling, drainage, redness, tenderness, any of that. And if we noticed any of that, we would also, we would obtain a culture at this time. So next, we're going to remove our clean gloves and our old drain and dispose of those. And we are going to perform hand hygiene, and we are going to open our sterile kit. Normally this would be above our waist, because below our waist is not considered sterile. But for today's purpose, we are not going to. And so after we open our sterile kit, we are going to don our sterile gloves, being careful not to have our glove packaging touch our sterile field. Once we have our gloves on, we can arrange our stuff in our field, making sure that we do not place anything in the 1-inch border. And so first what we are going to do is we are going to take an alcohol swab, and we are going to start at the center of our insertion catheter, and we are going to go in semicircle forms, making sure that we do not touch the same spot twice. And we're going to go about 2 to 4 inches out. Once we do that, we are going to take our chlorhexidine prep. And what we're going to do with this is we are going to scrub vigorously in horizontal and vertical planes. And with our non-dominant hand, we're going to lift our catheter ports. So this hand is now contaminated. And we're also going to clean the catheter itself. And you would do this for 30 seconds. And you would let this dry. So once that is dried, you will take your BioPatch here, and you are going to place this around the catheter itself. Once it is on, you will you're going to take your Tegaderm out of here, which today is a paper towel, and you would remove the adhesive layer, and you'd be sure to be careful not to touch the inner portion, the sticky part that's going to be on the patient itself. And so what we're going to do is we're going to place this over it with the center portion over the insertion site itself. And normally this would already have adhesive stuck onto it, but today it does not, so we are going to apply tape. Like so. And so then once it is covered up, we are going to remove our gloves, glove to glove, skin to skin, as well as our mask, and then our patient's mask as well. Once we remove our patient's mask, we are going to gather all of our equipment and dispose of it. And we are going to take a piece of tape, and we are going to write on it the date, the time, and we're going to initial it. We're going to place this on here. We're going to lower the bed, raise the side rails, and we are going to perform hand hygiene. And after we perform hand hygiene, we are going to leave, and we are going to document the date, the time, the type of cleanser that we used, if there was any drainage, what site it was at, and what type of dressing we used. So with that, that concludes my video.